Holiday gatherings bring folks together and can be a good time to discuss medical issues that may reside in families. Lots of diseases can be more easily managed and often minimized or even prevented if identified early. Our medical expert, Dr. David Winter with Baylor Scott & White, joins us with suggestions for a useful discussion you may want to consider over the upcoming festivities. Give us your advice on what could become useful conversations among families, Doctor.
Now I've got my buddy here to help demonstrate that the organs of our body, the brain, the heart, the lungs, the liver, the intestines, the kidneys, all these can become damaged or wear out prematurely in certain families. So it's good to know what runs in your family, because when doctors know that, they can do things that might help to either delay or even prevent conditions that are already existing in parts of your family.
Surely appreciate your buddy being there to help us out with today's discussion. It does sound like you are talking about getting regular checkups to bring conditions like high blood pressure and even high cholesterol levels to the attention of physicians, who can then work to bring them under control earlier.
Exactly, that's right. And also with cancer screenings now, there's recommendations for when you should get cancer screenings. But if there's cancer in younger people in your family, that could all change. For example, someone in your family has colon cancer at age 50. You want to go 10 years before and start at age 40. So knowing what runs in your family can help your physicians figure out how to best take care of you.
That is certainly a very important discussion. I know in my family we've talked about breast cancer, as my mom is a survivor. Now, there are blood tests that we were just talking about that can now detect cancer cells early. We have heard that companies now offer cancer screenings designed to pick up particles of cancer cells at very early stages. Can you talk about that more?
Yeah, there are a couple companies that do this right now. They tend to be pretty pricey, and they don't often find something, but when they find an abnormality, they often can find it at a curable stage. So those are available. I expect the prices to come down in the future and then be more popular, but right now, some people get them, many people don't quite use those quite yet.
Now, I know a lot of us are familiar with CT and MRI scans. Now, that is sometimes used for screening, correct?
We are doing those things. A CT body scan, for example, can show early plaque development in your arteries. And when we see that, aggressive cholesterol control can prevent that plaque from growing. Also, we used to do chest x-rays and look for lung cancer in smokers. We usually didn't find it in time, so CT lung scans work much better. So if somebody in your family doesn't smoke and has lung cancer, or if you're a smoker, you might want to get a lung scan on a regular basis to help find that at an early stage.
There is also genetic testing. I know I was not familiar with genetic testing up until about 5 or 6 years ago. Because of the genetic makeup, some people are more predisposed to get cancers, to get certain cancers rather than others, correct?
Yeah, indeed, the BRCA gene, BRCA gene, if you have that and you're a woman, increased chance of breast cancer, ovarian cancer for men, prostate cancer for both, cancer of the pancreas, those are very helpful also. Overall, though, I think it's really helpful to know what runs in your family. Grandparents, parents, brothers, sisters, siblings, any cousins, any of those folks with diseases, let your doctor know about that, and your doctor can take much better care of you, Natalie.
And the only way to know about that is to have these discussions, and Thanksgiving might be a good time to do that with everyone in the room. Doctor, thank you so much for joining us this midday.
Indeed. Happy Thanksgiving.
Happy Thanksgiving to you.